Today we will talk about the occipital bone. So occipital bone, it is a curved plate of bone and it is placed in the posterior part of the skull. The bone lies in the median plane or in the midline, and it has a foramen magnum. In the lower part it has a foramen that is known as foramen magnum, and this foramen magnum actually divides the bone into four parts: an expanded plate of squamous part, and which is placed upward and backward, and a basilar part which is directed forward and upward, and a pair of condylar part which is located lateral to the foramen magnum. So these are the squamous part, this is basilar part, and on two sides lateral to the foramen magnum there is condylar part. Now come to the scomas part. What are the parts of the scomas part? Scomas part has two surfaces. It has an external surface and internal surface. This is the internal surface, and rest of the is the external surface. It has two borders, two superolateral border and two inferiolateral border. These are the two superolateral border, and these are the two inferiolateral. These are the two inferior borders, and it has three angles, one superior angle and two lateral angle. It has one superior angle and it has two lateral angle. These are the angle. Now come to the external surface. At first we will talk about the external surface. In the external surface there is a round elevated portion, bone elevation, that is known as external occipital protuberance, which is marked here. This is external occipital protuberance, a median elevation. Now, the most prominent portion of the external occipital protuberance is known as the Inion. From the external occipital protuberance, a pair of arched line, it is gone laterally, which is known as superior nuchal line. These are known as superior nuchal line. And here there is attachment of the investing layer of the deep cervical fascia along the entire extent, and along the medial part there is attachment of the trapezius, and in the lateral part there is attachment of the sternocleidomastoid. Now the superior nuchal line, actually it forms the boundary between the scalp and the neck. That means above the superior nuchal line, this area will be the area of the scalp, and below the superior nuchal line, the area will be the part of the neck. And this superior nuchal line, it divides the squamous part of the occipital bone into upper planum occipitali and lower planum nuchali. That means this superior nuchal line, due to the presence of superior nuchal line, it divides into two parts. It divides the squamous part into two parts: upper planum occipitali and lower planum nuchali. And just above the superior nuchal line you will find another, just above the superior nuchal line you will find another arched line, that is known as highest nuchal line. This highest nuchal line, it provides attachment to the gallia aponeurotica in its medial portion, and in its lateral portion there is attachment of the occipital belly of the occipitofrontalis. And you will find a crest like structure. From the external occipital protuberance up to the foramen magnum. This crest-like structure is known as the occipital crest. occipital crest, and the area between the superior and this external occipital crest provides attachment to a ligament that is known as ligamentum nuchae. And you will find another arched line that is known as inferior nuchal line, and you will find this line between the external occipital protuberance and the margin of the foramen magnum. Along the inferior nuchal line, it provides attachment to semispinalis capitis in the medial portion, and laterally you will find obliquus capitis superior in the lateral portion. And the area between the inferior nuchal line and the posterior margin of the foramen magnum, you will find another two muscles, that is the rectus capitis posterior minor more medially, and laterally you will find rectus capitis posterior major. Rectus capitis posterior minor medially and rectus capitis posterior major in the lateral portion. So these are all about the external surface of the squamous part of the occipital bone. Let's see the muscular attachment once again from another picture. So look at that. We told you that so let's have a summary on the muscular attachment on the external surface of the squamous part. Look at that. This is the external occipital protuberance, and from the external occipital protuberance, this is the external occipital protuberance, and here there is the superior nuchal line, and along the superior nuchal line, look at that, there is origin of the trapezius and sternocleidomastoid. There is the trapezius and there is the sternocleidomastoid. Then in the you can see the attachment of the semispinalis capitis, obliquus capitis superior along the inferior nuchal line, and area below the inferior nuchal line you can see the muscular attachment of the rectus capitis posterior minor medially and rectus capitis posterior major laterally. So these are the muscular attachment of the external surface of the squamous part. Now we will move to the internal surface or internal part of the squamous part. Now we will talk about the internal surface of the squamous part of the occipital bone. Now look at that. Just in the center there is a elevation that is known as internal occipital protuberance, and a cruciate arrangement of lines or sulci. It is radiating from this internal occipital protuberance. A cruciate arrangement of sulcus or line, and a sagittal sulcus extends upwards to the superior angle. So this is the sagittal sulcus extending up to the superior angle of the squamous part, and this sagittal sulcus lodges a venous sinuses, dural venous sinuses, that is known as superior sagittal sinus, and the margin of this superior sagittal sulcus, the margin of the sagittal sulcus gives attachment to a dural fold that is known as fox cerebri. And you can see transversely there are two transverse sulci from the internal occipital protuberance extending from each side of the internal occipital protuberance up to the lateral angle of the squamous part. This is known as transverse sulcus, and it lodges transverse sinuses, a dural venous sinuses, and the margin of the sulci gives attachment to a dural fold that is known as tentorium cerebelli. So here there we will find transverse sinuses, and the margins or the lip of this sulcus provides attachment to a dural fold that is known as tentorium cerebelli. Now, from the internal occipital protuberance, there will be a crest, formation of a crest extending up to the foramen magnum. This is known as occipital crest, and here you will find occipital sinuses, and at the margin of the lip there will be attachment of a dural fold, that is the fox cerebelli. You will find fox cerebelli, and when this occipital crest goes downward, it forms a triangular depression which is known as Vermian fossa. In the Vermian fossa, we will find the inferior vermis of the cerebellum. Now, in the level of the internal occipital protuberance, this is known as confluences of the venous sinuses, because all the venous sinuses meet here. Look at that. At the confluences of the sinuses, superior sagittal sinus, it is usually continuous with the right transverse sinus, and the straight sinus usually it meets with the left transverse sinus. So look at that. Due to the cruciate arrangement of the venous sinuses, the internal surface of the scomas part is divided into 4 fossa. 1, 2, 3, 4. This upper two triangular fossa, it is mainly for the accommodation of the occipital lobe of the cerebral hemisphere. There will be occipital lobe of the cerebral hemisphere, and the lower two quadrilateral fossa, here there will be accommodation of the cerebellar hemisphere. So above there will be cerebrum, and below there will be the cerebellum, and above there is the cerebrum or cerebral hemisphere. So above there is cerebral hemisphere, and lower two quadrangular fossa, it is for the accommodation of the cerebellar hemisphere. Now come to the borders, two superolateral borders. These are the two superolateral borders. These are the serrated borders and articulates with the parietal bone and forms half of the lamboid suture. Now come to the inferolateral angles. These are the inferolateral angles. The inferolateral angles actually extends from the lateral angle up to the jugular processes, and it is serrated for the articulation with the mastoid part of the temporal bone. So this part articulates with the parietal bone, superior lateral border, and inferior lateral border it articulates with the mastoid part of the temporal bone. Now come to the superior angle. This is the superior angle. It is the meeting point of the sagittal suture and lamboid suture, and it is known as lambda. And the posterior fontanelle is located here in the fetal skull. Now come to the lateral angle. There are two lateral angles. This lateral angle is the meeting point between occipital bone, parietal bone, and mastoid part of the temporal bone, and this part is also known as asterion. And here you will find posterior lateral fontanelle in the neonatal skull. Now move to the basilar part. This is known as basilar part or basi-occiput. Basilar part or basi-occiput. It extends upward and forward from the anterior margin of the foramen magnum and up to the body of the sphenoid bone. What are the parts of the basilar part? Basilar part has 3 surfaces: anterior surface, basilar part has three surfaces: anterior surface, superior surface, and a posterior surface. Sorry, anterior surface, superior surface, and a inferior surface, and two lateral borders. You will find two lateral borders. Now come to the anterior surface. Anterior surface is quadrilateral in outline. It is rough and articulates by a plate of hyaline cartilage with the posterior surface of the sphenoid bone. It articulates with the sphenoid bone and forms a primary cartilaginous joint, which is known as synchondrosis. And this cartilaginous joint is converted into bone, that means it ossified at the age of 25 years, and then its name is synostosis. Now come to the inferior surface, that means posteriorly, that means the lower surface or inferior surface. It faces downward and it presents a pharyngeal tubercle. Let's see the pharyngeal tubercle from a different picture. So we are talking about the inferior surface of the basilar part. So look at that, in the middle there is a pharyngeal tubercle, and this pharyngeal tubercle, it gives attachment to the upper end of the fibrous raphe of the pharynx. It gives attachment to the fibrous raphe of the pharynx, where all the constrictor muscles of the pharynx are inserted. All the constrictor muscles of the pharynx are inserted. And you will find a depression on each side of this pharyngeal tubercle, and at this depression there will be attachment of insertion of the longus capitis muscle. And close to the anterior end of this tubercle, you will find insertion of the rectus capitis anterior muscle. Now come to the superior surface of the basilar part. This surface, in the superior surface, it forms a shallow gutter, and it forms a part of the clavus. The superior surface, it forms a shallow gutter and forms a part of the clavus. The surface supports the pons and upper part of the medulla oblongata. This superior surface, it supports the pons, which is a part of the brain, pons and medulla oblongata, upper part of the medulla oblongata, and these two parts are separated by the basilar artery and branches of the basilar plexus of veins. And close to the anterior margin of the foramen magnum, there will be attachment of some structures from above downwards. You will find membrana tectoria, upper band of the cruciate ligament, and apical ligament of dens. Now come to the lateral borders. The lateral borders of the basilar part, actually they articulates with the posterior border of the petrous part of the temporal bone. They articulates with the petrous part of the temporal bone by some sutural ligaments. Now come to the condylar parts. So these are the some condylar portion. These are the condylar portion of the occipital bone. Each condylar part consists of two parts. One is condylar part proper and another one is the jugular process. So look at that, this is condylar part proper and this is known as jugular processes. Condylar part proper and extended part is the jugular processes. Now we will talk about the condylar part. The condylar part, the inferior surface of the condylar part presents an obliquely placed articular surface, that is occipital condyle. So we are talking about the condylar parts. So inferior surface, so this is the inferior surface of the condylar process. It presents a occipital condyle. So these are the occipital condyle on the condylar part. It occupies the anterior half of the outer margin of the foramen magnum, and this condyle actually it articulates with the superior articular facet of the atlas, that is the first cervical vertebra. So this occipital condyle articulates with the superior articular process of the first cervical vertebra, that is the atlas, and forms atlanto-occipital joint. Atlanto-occipital joint. The medial margin of the occipital condyle. The medial margin of the occipital condyle, it presents a tubercle. It presents a tubercle which projects into the side of the foramen magnum for the attachment of alar ligament. So from the medial part of the condyle, there will be a tubercle. There is attachment of the alar ligament, and this alar ligament divides the foramen magnum into a anterior smaller part and a posterior larger part. And if we see from another picture, so this is a lateral view. Here you will see a canal that is known as hypoglossal canal. This is the hypoglossal canal. So at the junction of the anterior 1/3 and posterior 2/3 of the occipital condyle, just below it you will find a canal that is known as hypoglossal canal. This hypoglossal canal transmits the hypoglossal nerve, meningeal branch of the ascending pharyngeal artery, and sometimes emissary veins. So this is the hypoglossal canal. You are seeing this lateral view. So you are seeing these are the hypoglossal canal. So you have to know the contents of the hypoglossal canal. This is very much important for the viva. Now we will talk about the another part of the condylar part, that is the jugular processes. We will talk about the jugular processes. The jugular processes, it has an anterior margin, lateral margin, two surface, upper surface and lower surface. So as this is very smaller part, it's very difficult to identify the structures. So its anterior margin, it mainly forms the posterior boundary of the jugular process. Its anterior margin, it forms the posterior boundary of the jugular foramen. Its lateral margin, it articulates with the petrous part of the temporal bone, and its lower surface is rough and provides attachment to the rectus capitis lateralis muscle. And upper surface, in the upper surface there will be lodgement of the sigmoid sinus. Now come to the huge thing, that is the foramen magnum. It is a large oval aperture in the occipital bone, and it communicates the posterior cranial fossa with the vertebral canal. So you have to know the contents of the foramen magnum. What are the contents of the foramen magnum? This is a must asked question in the exam, viva exam. Everyone will be asked the content of the foramen magnum. I already told you where there is a foramen, you must know the content of that foramen. So we already told you in the medial part of the occipital condyle there is, for instance, a tubercle, there is attachment of the alar ligament, and this alar ligament divides the foramen magnum into anterior small portion and a posterior larger portion. Through the anterior portion or anterior compartment from before backwards, you will find the apical ligament of the dens, upper band of the cruciate ligament, and membrana tectoria. And in the lower larger portion you will find, before going to lower larger portion, the smaller portion contains, we told you, apical ligament of dens, cruciate ligament, and membrana tectoria. So all these membranous structures and ligaments are present in the anterior smaller compartment. So that's why its another name is osteoligamentous compartment. And the structures that passes through the posterior larger compartment, these are the lower end of the medulla oblongata, the meninges, fourth part of the vertebral arteries surrounded by the sympathetic plexus of nerves, spinal root of the accessory nerve, anterior and posterior spinal arteries, and tonsils of the cerebellum. So that's all from the occipital bone.